Since 2006, the Community Health Initiative of Orange County, or CHIOC, has been on the front lines protecting the right to affordable health care for the most vulnerable in our community. For the past 15 years, CHIOC has guided more than 100,000 residents to services ranging from health insurance to housing. CHIOC's mission has evolved to ensuring healthcare access for all Orange County residents, regardless of status. And CHIOC looks forward to expanding its services and support over the next 15 years and beyond.
I got my daughter the COVID-19 vaccine to keep her safe.
I got the shot so I can safely see my friends again.
I got the vaccine so I could visit my grandparents.
I got vaccinated because it's the best chance I have to stay safe from the COVID-19 virus.
The COVID-19 vaccine is safe and very effective at protecting you and your family from the serious and long-term effects of the virus. It's up to us to stop this pandemic and keep our kids and community safe.
Welcome to CHIOC's 6th Annual Building a Legacy Celebration. I'm Georgina Maldonado, Executive Director of the Community Health Initiative of Orange County. I'm excited to have you all join us today. We had hoped to be back in person this year, but unfortunately, we are all still dealing with this tragic pandemic. We at CHIOC hope that you and your family are healthy and thriving. Before I start our program, I want to take a moment to thank our Health Champion sponsors, Hoag, Kaiser Permanente, St. Joseph, and UCI. It is generous sponsors like you that step up to enable CHIOC's work so we can continue to serve our clients, and we cannot be more grateful. During today's event, we are excited to highlight the work that CHIOC staff does every single day to help our clients access quality and affordable healthcare. We will be visiting with 2 clients who will share how their families have been dealing with the effects of this pandemic. We will also be joined by a very special guest, U.S. Senator Alex Padilla, who will talk about his fight for healthcare access and equity. And last but definitely not least, we will be celebrating this year's Healthcare Hero honorees, the Unified Incident Commanders for the Operation Independence Incident Management Team, Division Chief Mike Petro and Deputy Agency Director Dr. Margaret Bradenhoff, for their leadership in addressing our county's COVID-19 crisis. In the last year, as the pandemic persisted, CHIOC, like other organizations, had to pivot and make technological upgrades to better assist our community virtually. We served over 5,000 community members with health insurance coverage, CalFresh, and other social service needs, such as cash aid and housing. And in partnership with the healthcare agency at their vaccination pods that are nested in Orange County's most vulnerable communities, CHIOC team attended over 100 vaccination sites and encountered 16,000 community members. We assist our clients to navigate the complexities of the healthcare system, social services, food insecurity, and housing. We are facing a long-standing system of inequity, and we are determined to fight for each and every one of our clients. I am so proud to have you with us this year as we celebrate CHIOC's 15 years of service to Orange County. In our 15-year history, we have built a solid foundation for our community and a reputation of care to the most vulnerable among us. Started in 2006 with a focus to ensure all uninsured children in Orange County, CHIOC has evolved our mission to improve access to health care for all ages. In response to a recent bill authorizing Medi-Cal eligibility for 50 and over undocumented adults, CHIOC will now work to reach these individuals who have never had health insurance before. We will also excited to announce that we can now enroll individuals 65 and over into Medicare. As we look forward to the next 15 years, CHIOC has just completed a strategic plan to strengthen the organization with 6 guiding pillars: marketing and brand awareness, social enterprise, financial stewardship, fund development, governance and leadership, program services, and advocacy. I am so proud of the work that CHIOC does in our community each and every day, and I want to introduce to you Louis Mesa, Danielle Cruz, and Bertha Ceja, just a few of CHIOC's dedicated health access specialists.
I love my job. I love helping families. I mean, we with CHIOC go above. I mean, if we have a family came to apply for food stamps and they don't have foods today, we try to call and get them resources where to go pick up food, or if they need diapers, if they need formula for newborns. So we always go beyond our job duties. I mean, we're here for the community, and if they need our help, then we're there to assist them with whatever they need.
I think what hits me the most is when they're closer to my age, and so this person was a similar age and first time kind of even accessing public services, and had a lot of anxiety about it. And I was just able to talk with them through and say the same thing I say to a bunch of other people, and afterwards they said, hey, this is really helpful. I was really overwhelmed and didn't want to do this, but I need to get care, and so thank you for helping me with that.
Thank you, Bertha and Danielle. I'm Louis Mesa. Bertha, Danielle, and I are excited to join you today to share more about CHIOC's work here in Orange County. We have two client stories to share with you. Elizabeth Martinez and Miriam Okorajor are two community members who we have worked with over the years to help them access the health care that they and their families need. The relationship we build with our clients are very special, and access to healthcare is critical to maintain a quality of life we all deserve. As you listen to their stories, you'll notice they both have a grateful heart and have a deep sense of service to their community. Supporting individuals and families like this is what makes our jobs at CHIOC so fulfilling.
In September, my husband and I, we had an accident. A trailer truck hit us. The driver fled, and we didn't know if Medi-Cal would cover us. We were very nervous because we don't have legal status. We don't have that medical insurance that we need, but thanks to God, Medi-Cal covered us. And I've had Medi-Cal since 2013. Medi-Cal has helped my children with access to dental care, to ophthalmologists, and I really think that these are good options that we need to have for those in the Latino community who do not have legal status, who are always worried about these problems. And if we're all right, then our families will be even better. Well, I've known Louis for a while now. We met back in 2013 when he helped me. He's always supported me and my community. We as community leaders, we are always looking for resources to support our community, to support our neighborhoods, to support those in our community who do not have legal status here, because it's difficult. It really is difficult to apply when you don't have legal status. So he's done us the favor of helping. We have some people that are actively working with Louis right now, and well, I just want to say thank you for the support that we've received during all of these years. You know, we really need people who have good attitudes, because sometimes you go to an agency and you encounter people that might not have the most positive attitude. But with him, we've always had a positive experience. He always brings us information to the neighborhood. When we have a community activity, we ask him, well, I ask him for information, and we distribute that information to the community.
So she came in, she needed help, and we helped her enroll her children to the Kaiser Child Health Plan, which is for undocumented children under 18. So that's the first time we met. That's what I helped her with.
Well, I also work in the church as well. I'm a coordinator of a ministry called Imagma here in Santa Ana at the Immaculate Heart of Mary. We also have worked with Latino, we've worked with Brazilians, we've also worked with healthy communities. Also, OCO, well, really there are many organizations where we participate and volunteer.
She always comes back every year to renew her benefits. Not only that, but she would ask for flyers so she can pass out at her kids' school, and she's very involved in the community. So she would also take some flyers and pass them out at community meetings. And I would say, no, that's fine. And she would say, no, let me take some. I want to help you. You help me, so let me help you. I'm just gonna pass out the flyer, and then they'll call you. So yeah, she's very involved. Yeah.
Like I said, we work in the community, and because of this, we have the opportunity to share this information with the community. So we're always working, especially since I met Louis. He brings me information for the community, and we have helped, well, CHIOC has helped many people. We are just that bridge that brings information to those people who need it most, those who don't have legal status here in the United States and who we know are low income. So we work on this, and we continue to work on this. And all of the information that we can give our community so that they benefit themselves, we will continue to share that. I have 2 kids, a girl who is, well, she's a young lady now, she's 23 years old, and my son is 19. My daughter studied here in Santa Ana through high school, and she then transferred to UC Merced. And right now, she just graduated with a degree in anthropology and psychology. That's my daughter. And my son is currently studying college here in Santa Ana, and we hope that he will also graduate from a university.
I hope they're doing good. I hope that her kids graduate from university and college, and they're able to move on and pursue their dreams and give back to the community, just like the community helped them, hopefully, yeah.
During my medical checkup, they discovered that I had latent TB. So I went onto the internet and searched for where in Orange County I can get treated with that. And when I went and they were asking me, they asked whether I had medical insurance. I said no. So one of the nurses there came and said, come, let me show you, you go and apply for medical first. Lo and behold, when I went into the office, Bertha was there, and lo, she really was welcoming. When she told me her name, Bertha, I said, wow. I said, look at, we are 5 from my parents. The first one is a girl, and her name is Bertha, and I am the last born of the 5. So you are my elder sister's namesake. And I was so happy. I came back home. I called my family back in Africa. I said, see what happened. See what God did for me today.
The way you want to be treated, treat those families. families, if you're respectful to them, they open up to you. And that's how families keep coming back to us.
You know, I met Danielle. There is one other young man that I met. They are all the same. They are all so good. Those are very good workers, loyal, hardworking, conscientious workers.
Last week I had someone come in and they were just crying and at the end of their rope in that. So felt definitely that the world was against them and that all in that way. And afterwards said that it really helped to know that there was someone who wanted to advocate for them.
Danielle even gave me her own personal number and he said, Mama, if any day you need to ask questions, call me. This is my line. Call me anytime. I said, God in heaven, I thank you. This is one office that each time I go to your office there and I come back home, I sleep very well.
Wow, I don't know about you, but I found those stories from Miriam and Elizabeth so moving. CHIOC is so lucky to have dedicated staff like Louis and Bertha. Good afternoon, everyone. My name is Phil Sonoda, and I have the privilege of serving on the CHIOC Board of Directors. I am so proud to have played a small role in the expanded impact this healthcare service organization has had over the last 15 years. Particularly the support CHIOC has provided to Orange County's disadvantaged communities. I'm here today to introduce our featured speaker, United States Senator Alex Padilla. A Southern California native, Senator Padilla is the proud son of a hard-working immigrant family. From City Council to U.S. Senate, he has blazed a trail for California's Latinx community. Despite being in D.C. for less than a year, Senator Padilla has hit the ground running. He serves as the chairman of the Judiciary Subcommittee on Immigration, Citizenship, and Border Safety. He is passionate about pursuing equity in healthcare and social services for all, as well as the empowerment of young people and working families. Please join me in welcoming CHIOC's featured speaker, United States Senator Mr. Alex Padilla.
Hi, I'm Senator Alex Padilla, and I have the honor of representing Orange County and all of California in the United States Senate. Thank you for inviting me to join you as you celebrate the importance of equity in healthcare. I want to begin by thanking the Community Health Initiative of Orange County for your work providing Californians with critical health resources and support. Your essential services also empower young people and working families. Since I was sworn into the U.S. Senate earlier this year, my top priority has been supporting a full recovery from the COVID-19 pandemic. This pandemic has highlighted the importance of healthcare centers with strong community roots, but it has also created unprecedented pressure on those centers to address the buildup of inequities in our healthcare system. I'm proud to have cast one of my first votes in the Senate for the American Rescue Plan. The ARP brought tens of billions of dollars in direct assistance to help families, cities, schools, and small businesses survive the pandemic. It also sent $1 billion to 175 community health centers here in California to improve COVID testing, treatment, and vaccine distribution. Thanks to the aid in the American Rescue Plan, more than 56 million vaccine doses have been administered, helping protect more than 2/3 of Californians. But this is just the beginning of our recovery process. We must address the deep inequities in healthcare and social services that existed long before the COVID-19 pandemic. People of color, low-income communities, and immigrants have faced a disproportionate share of the pandemic's harms. As we look to the future, we need to apply the lessons we've learned to improve equity in all aspects of healthcare. Community health organizations bring a wealth of experience to draw on as we work together to build a better future. I look forward to keeping up the fight for equity in healthcare as Congress advances a bold budget reconciliation bill. We need to aim high and act with ambition. I'm also fighting to fairly compensate care workers. to increase mental health services, and to build an economy that works for working families. I want to thank the Community Health Initiative of Orange County once again for your work to promote equity in healthcare, and I look forward to continuing our partnership.
Thank you, Senator Padilla, for continuing to fight for the needs of all Californians. We could not have asked for a fiercer advocate. My name is Rita Cruz Gallegos, and I serve on the board of directors. I am excited to be here today to help highlight CHIOC's incredible work. Last December, during the first COVID-19 spike, a county-wide initiative was activated in response to the pandemic. The Incident Management Team, or IMT for short, had a goal to vaccinate all Orange County residents by July 4, 2021. This massive effort, known as Operation Independence, was a collaboration of the Orange County Fire Authority, the Orange County Healthcare Agency, local department and agencies, and community partners like CHIOC. The IMT worked to reduce and eliminate barriers to vaccine access, especially for the most vulnerable in our community. Operating under the objective of one county, one mission, the IMT facilitated the widespread distribution of COVID-19 vaccines through points of dispensing sites, or PODs. Led by the IMT's incident commanders, Dr. Margaret Bradenhoff, Deputy Agency Director, Healthcare Agency Public Agency Services, and Division Chief Mike Petro of Orange County Fire Authority. IMT worked to accomplish its mission amidst constant fluctuations in vaccine supply and an ever-changing landscape. Their dedicated efforts resulted in 5 super PODs distributing vaccines along mobile strike teams designated to teach the hard-hit communities. IMT delivered over 1.2 million vaccine doses before July 4th. Not only was Orange County able to accomplish its mission to reach 70% of adults on their path to vaccination, but critical resources and health linkages were made available to our residents to support health and vitality as we began the recovery phases of COVID. CHIOC is proud to be a partner in this effort and is pleased to present the Incident Management Team at this year's Healthcare Hero honoree. Accepting the award on behalf of IMT, its incident commanders, Dr. Margaret Bradenhoff and Division Chief Mike Petro.
Hi, I'm Margaret Bradenhoff, Deputy Agency Director for Healthcare Agency.
And I'm Mike Petro, Division Chief for the Orange County Fire Authority. I would like to take this time to thank CHIOC for this honor, being recognized for Operation Independence. It seems like almost a lifetime ago, going all the way back to January 1st of 2021, when we convened at the Healthcare Agency for our first meeting, bringing together representatives from law enforcement, fire, and the Healthcare Agency, and talking about what needed to get done. Most of us not having any experience. To be honest with you, I don't think the nation had any experience of how you would build a super pod and vaccinate nearly 3.2 million people. Collectively, through a lot of brainstorming, as Dr. B would say, a lot of failing fast, the collaborative effort that involved lots and lots of people, both those that worked for the county, worked for different fire agencies, law enforcement agencies, and those that were nonprofits that came alongside and worked together, representing truly a one county, one mission philosophy that overwhelmingly brought thousands of people to our super pods and our mobile pods for vaccinations.
And it was truly in the spirit of one county, one mission that we quickly saw the opportunity where our vaccination pods was a wonderful way to not only vaccinate individuals, but give them resources that can help them along their journey as we respond and recover from COVID. So the collaboration with CHIOC was actually a very brilliant collaboration. Not only were we there in the neighborhoods that was hardest hit, but we were able to give them resources, get them health insurance, and really set them on their path to recovery.
It is truly a pleasure to be recognized by CHIOC as a healthcare hero. It is humbling and an honor to receive these awards.
Yes, and we gladly accept, really on behalf of the thousands of men and women, entire county, of accomplishing this mission of Operation Independence, One County, One Mission. Thank you so much.
Thank you.
Thank you, Dr. Breda Hoft and Division Chief Petro, for all of your efforts to protect the health of the residents of Orange County, especially right now when we are all dealing with so much. I'm Tammy Alvarez, the chair of CHIOC's Board of Directors. As you have heard today, CHIOC works every day to safeguard the healthcare needs of the most vulnerable in our community, and it has never been more important. We have seen a lot of progress in our first 15 years and will face many challenges in our next 15 as the healthcare landscape continues to change in the face of today's COVID-19 crisis and post-pandemic world that lies ahead. What we do know is that CHIOC staff will continue to work tirelessly to advocate for every single client, and we could not do that without your support. With the lasting effects of the pandemic, the need for CHIOC services will only grow, and we hope that you can help us meet that need by making a gift today. Please go to chioc.org and donate now. If you're able to make a gift of $27, you can cover the cost of care coordination for one individual or family. For those of you that can make a gift of $72, you can help CHIOC cover the cost of enrollments for an individual or family. If you are able to make a gift of $266, you can cover the cost of an outreach event. And a gift of $365 can cover the total cost of all services for an individual or family for 1 year. We ask that you give what you can. Please go to chioc.org to make your donation. Thank you so much for joining us for our Building Legacy celebration. Thank you to our sponsors and donors. Have a great day.